The White House wants to spend more than $88 billion to prepare for the next pandemic or biological threat. That number is not too far off from the recommendations of the Bipartisan Commission on Biodefense. Ambika Bumb is the organization's Deputy Executive Director. Ambika, welcome to the program.
Thank you. Thank you for having me.
All right, start by outlining the current biological threat. What does the world look like right now?
Yeah. Well, not to sound all doom and gloom here, but there are a lot of biological threats ongoing at the moment. Of course, we have the ongoing COVID pandemic. There is monkeypox. We've seen traces of polio. We've got highly pathogenic avian influenza to consider, and also African swine fever. There are a number of natural threats that exist. And of course, then we've learned that Russia and others are developing biological weapons as well. And so there's always the concern of an intentional attack through a biological weapon. So there's a lot to be concerned about and a lot to try to defend against.
The Commission is calling for an Apollo program for biodefense. Will mounting a defense against infectious diseases be as hard as getting to the moon?
It is as ambitious of a program as that, but it is very doable. What the Apollo program is laying out what are the science and technology priorities that we really need to tackle and it identifies what needs to be done with them in order to protect us. So that's from vaccines, diagnostics, therapeutics, biosurveillance related sequencing, and PPE, laying out what are the tools that we can have in our arsenal to protect against these. And what we've seen with COVID and with the vaccines and what we've seen with the diagnostics there, that it is possible. Now we just need to have a plan to be able to execute effectively whenever any new threat occurs.
Well, that report was released in January of 2021. What were some of the major recommendations and what progress has been made since then?
Yeah, so it covers some of these technologies. There were 15 technology priorities that were laid out. And so it starts from diagnostics, the testing that we need. It includes the vaccines, to be able to have a vaccine in place for each of the 26 families of viruses that can transmit to humans.
And do we have that? Is that already in place?
It is not. We do not have that, and we're working towards that, and that needs to be in our arsenal. We need to have that in place, and that requires research funding. It requires the coordination of government agencies, and it requires having a plan to execute on, right? So that's the vaccine side of things. There's also making sure we have PPE. We have the right manufacturing in place to be able to produce these tools that are specific for medical countermeasures, right? We saw some challenges with manufacturing right now with monkeypox vaccines. So it's laying out 15 technology priorities specifically.
And how far along have we gotten? I mean, given the experience that we had with COVID,
yeah.
I mean, what has already been put in place, if anything?
So there are a couple of different things that are happening right now at the federal levels. The White House did put out the American Pandemic Preparedness Plan last year in September. And actually today they're going to be discussing their annual update on how that has gone. So we'll hear more about that later today. But the president put out the president's budget request, which also lays out a large amount of money, $88 billion for pandemic preparedness initiatives. They're working on, in 2018, the National Biodefense Strategy was released, but the implementation plan for that had some work that needed to be done, and that is now going to be, they're working on that, and hopefully it will be released soon. The Department of Defense is working on revamping their biodefense strategy. So there are different pieces of this that are in play right now. It's in an interesting time period because we've just gone through COVID. It's a higher priority and it's moving in many ways. But in terms of fully executing it, it's not there yet.
And is that why the Commission released a second report called the Athena Report?
Yes. So earlier this year, we released the Athena Agenda, which was specific recommendations on how to actually achieve those 15 technology priorities that were laid out in the Apollo report.
So how much would all this cost? How much would Congress have to allocate if all your recommendations were fully implemented?
Yes, we've laid out that it's $100 billion over 10 years. And so, yes, that's what we think it will take to be able to achieve this.
And is it worth it to the American taxpayer?
Oh, of course. Oh, my goodness. The amount of money this saves in the bigger picture, if you're looking just at financials, investing that money now prevents deaths. It impacts our economy. I mean, I'm sure you've had many people speaking about the impacts of this on a broad scale for the country in whole. This is just a penny to be able to save hundreds later.
And does it really work? I mean, can global pandemics actually be avoided? Or is this just something that we are going to have to live with and we just need to be a little bit better prepared for it?
They can be avoided. We can't prevent having outbreaks. There will be natural diseases that arise, but we can prevent them from turning into a pandemic. So that's by stemming them and containing them as they first approach. So we have to be able to identify them quickly. We have to have eyes on the ground, which is where the diagnostics and testing piece has to. There has to be good communication of those testing results to a central source so we can track everything. And then you have to release the vaccines and the therapeutics that are necessary to treat to stem it from further spreading. So.
And you alluded to monkeypox earlier in the program. What have we learned from that outbreak? What do we know about how that's being managed?
So monkeypox, we first learned of it in May. And there are some interesting pieces here to look at. And initially, it took 35 days for the testing to be available, to go from being in the CDC's public health laboratories into commercial laboratories. So testing ramped up from less than 100 to a week to 6,000 a week to now 80,000 tests a week. So there has been ramping up, but we needed that early on, right off the bat, to be able to better get a hold of the numbers of where things are. Vaccinations, while we were better prepared for this disease because we already had vaccines in the national stockpile. However, the quantity was not sufficient because there were some that had expired, and there were many amounts of it that were out in Denmark, and bringing that over, that delayed response was also not ideal. Fortunately, right now we're seeing that we've gotten past the peak, and it looks like we're on a decline in the number of cases, but we can't ever just sit back and say it's over. We've seen with COVID.
And we'll certainly watch
a reemergence, yeah.
Exactly. Ambika, thank you so much for being on the program.
Thank you. Thanks for having us.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.